Like many things in 2020, the holidays are going to look different this year. Spectrum News 13's Eric Levy spoke with a health expert about some things you can keep in mind as you navigate the pandemic and the Thanksgiving holiday.
So what do we need to know about the holidays and the coronavirus? Obviously, the CDC recently has been really trying to send home the message of smaller groups and try to do the holidays, breaking with tradition, unfortunately, doing it online.
Yeah, so knowing that there's corona fatigue, I think the important thing to remember is not to let your guard down. The virus is still with us. And there's been some great news about solutions on the horizon, but they're not here yet. So we need to stick with the basics and the fundamentals about prevention.
So do you think it is safe to then hold Thanksgiving dinner or, travel to, families' homes as you normally would?
Well, I think with travel, you have to consider, where you're going. Wouldn't necessarily want to go to North or South Dakota right now. Mm-hmm. But, is it a hot spot where you're going? How are you going to get there? What's the mode of travel? And who are you going to be with? Is it going to be a small, tight group of family? Is it going to be larger gatherings? That type of thing. I intend to travel during the holidays, but took care to book an airline, for instance, that's, spaced between seats and done a good job, and going to visit a small number of my relatives in Colorado, which is a state that's done a very good job of really containing coronavirus.
We're hearing that there's going to be a spike in positive cases after the holiday. There is always that potential after any holiday. I mean, we saw it after Memorial Day. Anytime there is a chance that a large number of people are going to be together. What is your take on that?
Well, unfortunately, we may see an increase in cases after the holidays. The virus is about time and distance, and the holidays tend to create gatherings and with the travel and so on. So it is ripe to increase the exposure. And again, hopefully people will just not let their guard down and follow the appropriate measures.
Well, I want to talk about recently the race for the vaccine, because that's what many doctors are saying, that once there is a vaccine that can be given to the general public, and a large chunk of the general public, not just considered those at high risk, that is going to be a major help. And as a matter of fact, we've had the companies, within the last couple of weeks coming out and saying the effectiveness of their vaccine is looking really, really good. What are you hearing kind of just in general terms within the last couple of weeks? What are you hearing when a vaccine would be readily available?
Well, this is huge for our country. This is really the only way we're going to get to herd immunity, short of very many people being infected and all the consequences of that. So both Moderna and Pfizer using a similar technology in their vaccine, one that's never been used before. And based on the technology, it's not necessarily surprising that they may turn out to be some of the most effective vaccines that we have. And if that holds true, then we're very hopeful that if we can get enough people vaccinated quick enough, we can get through this thing.
Yeah, I mean, because that's really what it's going to take, or one of the things that it's going to take to be able to get back to as what people are calling normal.
Yes, and really you do have to reach something around herd immunity. Obviously, when there's a point when I can't transmit it to you because you've already had it, and there's enough people around me like that, then the virus goes away. So, but to get there through people having had it is not a great solution. So vaccinations are always the key to controlling these kinds of infectious diseases. And to have a vaccine this quickly to this type of virus and with this new technology as effective as it is really remarkable and very hopeful.
Good friend of ours here at Spectrum News 13, Dr. Jeffrey Stalnaker with Health First. Thank you as always for spending some time with us.
Thank you.